Okay, so good afternoon, everyone. Let's continue this marathon of very interesting presentations. So I am Dirk Abeel. Formerly, I was a global medical sales director at Reckitt, and since the start of this month, I created my own company in really focusing on omni-channel transformation and transition in the life sciences industry. And I have the pleasure of being accompanied by Ian. Ian.
Yeah, thanks a lot, Dirk, and cool new name for the company. It aligns perfectly with the whole topic of today, and also in general, I think overall at this next Pharma Summit and discussing the new normal. So Ian Ballantyne, I'm sitting in Zurich, Switzerland. I'm the sales director EMEA at Pitcher, and it's a pleasure to meet all of you and to be able to have a chat with Dirk, who's so obviously a specialist in this space.
Thank you, Ian. So this is a very short bit the agenda we want to cover. As you can imagine, in 15 minutes, we need to be quite fast-paced, what is good. But I already focus on the bottom right. We, both Ian and myself, we are very open to continue the discussion after this session, with your own company to do a deeper dive, being from a strategic to platform and execution perspective.
Excellent. Thanks a lot, Dirk. So why don't you walk us through the evolution of customer engagement? I mean, we all know that in the last 18 months, things have changed drastically, and that actually could have an impact also on the way you see the way omni-channel evolving.
Yeah, without going too much into details, because during the last 2.5 days, we already touched base on that many times. I think what the most important point is that before COVID, a lot of companies were already thinking of going in a kind of multi-channel kind of direction. What happened with COVID was really this shock on the tree and accelerated the whole process to say, okay, if you really want to stay relevant in this volatile, uncertain, complex, ambiguous kind of reality, we need to reinvent ourselves and we need to go really in the direction of being customer and patient centric. So from traditional model face-to-face, we were balanced or even catapulted in digital only. And the new reality, as we know, will be hybrid, depending on the purpose of the interaction. So it is there to stay. And I think that's already one key lesson is don't ever think to go back to the old normal, because that would be a big mistake. So I don't know, Ian, if you want to add something here from your perspective.
Well, yeah, I mean, I mentioned on Tuesday already that the rep is so important in this whole journey around through omni-channel, because yes, you will be switching more to a hybrid approach. And yes, the customer will be touching upon either your brand, your company, or your products in a hybrid manner. So across different channels, remote, face-to-face. But the rep is still going to be key in executing on this omni-channel strategy, because how else are you going to have that interaction with the customer and encourage them to embrace the new normal?
Yeah, no, and I like to piggyback on what you just said. We are talking about this omni-channel transformation. I also would say, rather than cross-functional collaboration, we are also going to an omni-functional kind of collaboration to really help this hybrid model to be successful. So it's beyond the sales rep. It's really impacting the whole organization. And that's what you see on this slide, because with more channels, we have more touch points. So the risk to create more clutter is there. So we really need to make sure that every interaction we do is bringing value to each of our customer segments. We also really need to evolve the ways of working internally. And I already mentioned it is cross-functional or omni-functional kind of collaboration. And I think also in the front line, it's enabling reps to use the relevant channels. So this implies that, and that's, I think, a very important thing, that in this whole journey, which started a long time ago, we need really to make sure we have a continuous change management, and it's about winning the hearts and the minds, not only about the minds, but also the heart, the emotional side of our people. And this we need to continue. So Ian, when I say enable rep to use relevant channels, that's of course what you are focusing on. Can you shed some more light on this one?
Yeah, I mean, now put yourself in the shoes of the customer. I'm having maybe less touch points with my providers, or I'm having so many providers coming and pitching me a new product, and I need to see my patients or my customers myself. So I need to be really specific and selective in how I engage with my providers or with the influencers that are coming by and pushing and selling their products. So rather than, let's say, have an open office policy, I might say, okay, on a Monday, I'm open to face-to-face. And on the rest of the week, I'm going to choose how I engage with my provider. Meaning, if I'm a frequent user of WhatsApp, I'll tell the rep, please send me the information, the new product data sheets, the new studies, etc., via WhatsApp, because I'm more likely to look at this when I'm on my train ride home, or when I'm sitting at home in front of the TV, or when I have a space in between seeing my patients, rather than seeing it at home. Rather than looking at my email, because I mean my inbox is full, and depending where I am, there will be, maybe not any email in use. So one thing, and I think that's really important and to keep in mind when it comes to omnichannel, is localization. So each market operates in a different way. I mean, some markets still use fax, Germany, Canada, and some markets, if you look at China, they only use WeChat. So you really need to look at, have an omni-channel strategy globally, but then locally look at what are the channels that your customers are going to engage with.
Yeah, and that's a very nice introduction to this slide, and I like to call that a bit the mother chart of the whole omni-channel transformation, which should support the new normal. And it's really driving the positioning of the pharma industry, or the life science industry, as becoming trusted advisors, and also, I would say, customer experience managers. And if you look at the bottom of this chart for me, and it's related to what you said before, Ian, the first thing we need to think about as an organization, okay, if we look at our goals as a company, are the strategic imperatives related to our brands, are they still relevant and up to date to this new reality? And if so, what are the strategic proxies that enable us? How do we translate that strategy in something actionable? That's related to your segmentation model, which kind of behaviors do you want to drive, and so on and so forth. And then you look at, okay, what could be the conversion points in helping us to realize that? And I think about content. We spoke already many times about content, the metadata tagging behind, to really see which kind of content is really helping us to drive advocacy based on our segments, and also what kind of services can help us in achieving this change. And then we come to something what I always like to say, where people think we should start with that. It's about the tactics, and tactics in the omnichannel, one big one is the right channel mix. But you see, there are 3 points before you even can start thinking about what is now the relevant kind of channel mix to make that happen. And obviously, when you are at the start of the journey or you want to expand, it's about prioritization and planning. That also means it's looking at capabilities internally and externally. Do we have the right people? Do we have the right infrastructure? And last but not least, and you cannot manage what you cannot measure, it's about measurement. What is success looking like across all these touch points, and also giving the right actionable insights to all the key players within the organization, but also towards our, I would say, our customer base. And if you look on top, this 8 kind of bubbles, this is for me what really the sales organization is focusing on, based on what we just discussed. It's about being sure that we hit the right HCP at the right time, the right channel, with the right purpose, because the purpose will dictate which channel to use, and it will differ, supported by the right content, the right frequency, on demand, for example, right tools, and the right insight. So this is for me a kind of the virtuous circle, which from a theoretical perspective sounds quite easy to do, to make it happen. It's another kind of things. And it would be great if we could, in another occasion, go a bit deeper in each of these aspects.
Yeah, I mean, the key thing that I pull away from this, and I hope the audience do as well, is that there's strategy and governance required in any omni-channel journey, and that data is going to help bring that journey to the next level. So a lot of you might have omni-channel initiatives that are still in its infancy, and there will be some that have been doing this for quite some time. And I'm sure the ones that are more mature in their adoption of an omni-channel approach have got a lot of data that they can touch back on that then help you to get the right HCP with the right content at the right time and at the right frequency. Because You need to try, you need to test, and the data will then help drive these decisions, and it will help the rep to drive the discussion in the right direction.
Yeah. And I link back also what we said before, this whole change management, because this is a big change for a lot of people within the organization. It's critical that you keep on helping them to do that. What is in it for me? How is this helping me to bring value to my customers and their patients? So that's why we can say there are some critical steps to make this really work. And obviously, needless to say, why are we doing that? And I think that everyone knows the answer, but also what are the consequences of that if you look at our people's capabilities, the skills, the will to change, and the behaviors we want them to adopt to. Before going then to really creating this omni-channel experience, which is about a seamless experience across the whole value creation journey, independent from the channels we are using. So the importance of a proper segmentation, a whole matrix, and then of course using the right channels to orchestrate that journey, the sequence, which channel to use in which part of the sales cycle or engagement cycle, before we then also look at which kind of content do we use for that specific segment, but also adapted to the channel. And I already mentioned it, and I think, Ian, that's something for you, with the right also data mindset behind.
Yeah, absolutely. I mean, so the content is the driver. So if I have the right content on the right channel, then I'll have a higher engagement, which means that the data quality and quantity that I have will be able to help drive the next initiative. So they are all interlinked. They're all important. However, please don't underestimate how important and how much effort goes into creating the right content for the right type of interaction. Because, I mean, let's just use a very concrete example that some of you might be familiar with. On WhatsApp, advertisement is extremely difficult to get through. Facebook regulates this. So even choosing the right content for that channel becomes an activity and becomes a major task, because when you want to make iterations, it still needs to get verified each time. So really figuring out the right content for the right channel is a major initiative and requires lots of different stakeholders to get involved, from marketing to IT and so on and so forth.
Yeah, that always makes me make the comparison with, or the analogy with, a royal couple. Content is the king and the storytelling is the queen, because it's about this creation of this whole experience, as you mentioned. Absolutely. So, yes, Ian, you wanted to add something?
No, I was just saying, absolutely agreeing with you for once.
See, Ian is always a very nice guy. Huh? So, as you could see, we have been running really through a very vast topic. So I would like you to see this as a kind of a teaser. And I said, if you'd like to know a lot more about how to translate this strategic or the commercial kind of strategies in something actionable for the field force or the sales teams, supported with the right platforms and delivering the right insights, please do not hesitate reaching out to either Ian and myself. So many thanks, and I wish you a lot of pleasure with the oncoming sessions.
Yeah, thanks a lot, everyone, for your time, and hopefully we'll get a chance to connect in the new normal face-to-face next year, or even in the short term if you reach out.
Thumbs up for that.
Yeah, awesome. Have a nice afternoon and evening, everyone.
Bye-bye.
Bye-bye.